Okay, welcome to this episode of Rattling the Bars. Uh, Over the past year and a half, we have been following the spread progression of COVID-19 in the prison industrial complex. Some months ago, we talked to a couple professors who have created a program that helped monitor the spread of COVID-19. So joining me today to give us an update on what's going on in the prison industrial complex is Catherine Nowati. She's an associate professor at the University of Miami, and Dr. Lauren Brinkley Rubenstein, who is an associate professor at the University of North Carolina, Chapel Hill. Thanks for joining me, Catherine and Lauren. Thanks for joining me. Yes.
Yeah, thanks for having us.
I guess the first thing we need to know is exactly what's going on today in the prison industrial complex. What's changed since the last time we talked months ago? Where are we today? And both of y'all can respond to this. So you can start, Lauren, if you want.
Okay. Yeah. So I think the last time we talked, we were really still in the middle of a massive number of outbreaks across the country, really high caseloads. We still see higher caseloads today in the prison and jail population than we see in the general population. But since the introduction of vaccines, we have seen a pretty drastic drop-off in the number of cases across the country. Close to 30 states are giving us some data on vaccination. Most prison systems have vaccinated some proportion of their incarcerated population. And because of that, we have seen a dip in cases. Although I will, as usual, make the claim that there's not enough data. So still, data transparency continues to be an issue, and we don't know enough about what's happening behind the bars. But from the data that we do have, it does seem that cases seem to be lower and that there are less outbreaks today.
Okay, you wanna follow up on that?
Yeah, I think another caveat to what Lauren said is that now that states are starting to vaccinate some people who are incarcerated, their testing and surveillance systems are becoming less robust. And some states are sharing less information about COVID-19, or they've changed the way they're reporting their data. So it's becoming even less transparent than it was before in terms of data reporting.
Well, I think what concerns me right off the top is only 30 states are participating in giving data. That means there's 20 states that's not. And then you're saying that even among the 30 states, the data is less transparent than it was before.
Yeah, only 27 states are reporting their vaccine data in a public dashboard. The other states, we can only get information from media reports.
Yeah, and I'll say that as vaccination has come on board in various systems across the country, it actually has resulted in states giving us less relevant other data, right? So as we see vaccine go up, we actually see less information coming out around cases, testing, and other information that more states were giving us before vaccination.
Okay, so how does this compare to what's going on in the general society now? When we talked previously, it was 3 to 5 times more cases within the prison industrial complex. There was 5 times more incidents of fatalities among the prison outbreak. How does that translate now and compared to what's going on in the general society?
So we continue to see case rates that are higher than the general population, but we actually see something that is kind of interesting. In a number of states, we see that vaccination rates are higher in prison populations than they are in the general population. And so it's kind of been this interesting phenomenon to see that in prisons and jails, in some states, there are actually higher numbers of people who are vaccinated than in the surrounding communities. So in general, case rates still continue to be higher, but they're not as high as they were when we last talked. But vaccination rates are quite high in a number of states, although it's kind of misleading when you put all of these states together because they are pretty disparate. You know, when we look at Alabama, a very small percentage of their incarcerated population has been vaccinated. And we look at states like California or Virginia, almost all of them have been. And so it's hard to look at in aggregate, but it is really interesting that there have been some states that have had really robust vaccination campaigns.
Okay. I'm wondering, is there any way to gain the data other than news reports? And I'm talking about the 23 states now that's not cooperating, and even the 27 that are partially cooperating. Is there any other means to gain that data other than to depend on the prison administration or the or officials of that state? John Hopkins Hospital, for one, was keeping data of every case in America. Now, I don't know if that went into the prison system, but are there other systems available to extract that data from?
It's the perfect question. Catherine, I'll just quickly say that, we have tried other methods. We have called and emailed and even written letters to departments of correction that we don't have good data from with very limited success. There are also legal mechanisms. So our team is beginning to think about Freedom of Information Act requests to get data, although there are limitations to that method because you often have to pay for data and they can give it to you whenever they want. And so there's no timeliness requirement. The other thing I think that is really important is that there needs to be legislation and policy reform relevant to mandating departments of correction and jails to provide data in a timely way to the public.
Yeah, that's exactly what I was going to say. I think this is really an example of the siloing between public health and corrections. So the data that Johns Hopkins is aggregating, for example, is coming from departments of health. It's coming from the CDC, which have been transparent in the way they're reporting data because they have a mandate, right, as part of public health to report what's happening with infectious diseases. Departments of corrections, it's not the same. They aren't reporting to the CDC, right? They aren't reporting to the Department of Health. They're reporting to nobody. And so that's part of the problem is we don't have a sort of a central oversight or central mechanisms that require departments of corrections to report these data to the public, or to federal bodies like Congress or the CDC. It's a big problem, even outside of COVID-19.
Yeah.
Okay. Well, one of the things, and I don't know if you would have information on this, but one of the things is that out in the general society, there seems to be some resistance to getting vaccinated. In some states like Ohio, say, for instance, they're offering a opportunity to win $1 million in the lottery if you get vaccinated. In other states, they are making other kind of incentives. What's the situation in most of the prison systems that you are getting data from? Is there any resistance, or is there methods to overcome that resistance? And I'll just back up 1 minute. Just recently, President Biden offered or is seeking 1,000 barber shop owners in the Black community to get involved to encourage the spread of the vaccine. So do y'all have any idea of what's happening inside the prison system in relationship to resistance? Catherine?
Yes, I think there's a lot of variability, and that has to do with education, right? And so there's some states, for example, we've heard where COs are just going around and being like, hey, do you want a vaccine? And putting people's name on a list. That's not good public health, right? That's not how, you get people to get vaccinated, right? People need to have the information about the vaccines. They need to know what they're getting. They need to know why they're getting it. And they need to be able to make an informed decision. And so having COs deliver that information, is not good practice, right? And so people are getting, sometimes information from COs who we know are really vaccine hesitant, or they're getting it from their family members or, hearsay. And so I think part of the problem about vaccine hesitancy is, the lack of, trying to educate people and provide them with adequate information so they can make a decision. And so I think some states have done better than others on that piece.
Yeah, I think that's right on. I mean, I think there are some states where there have been very high uptake rates in Rhode Island, for instance. About 77% of all people offered the vaccine opted to take it, which is much higher than we might have expected and much higher than we've seen in other vaccine scenarios in the past. I think in part that's because they had a good education campaign that allowed people to engage in vaccine deliberation, right? So ability to say no and think about it. And they also had a one-pager, an information document that was created in collaboration with people who had been incarcerated, that was handed out. And I think that made people who were incarcerated more likely to trust the efforts of the Department of Corrections around vaccine. And so I think there are a lot of lessons to learn across the country around education and around centering the voices of people who have been incarcerated in those education campaigns.
Mm-hmm.
Yeah, and I'll say I know some systems have attempted to use incentives, right? So you mentioned like the lottery winning $1 million. And so I know some systems have, tried to give in like commissary items or other things like that to incentivize vaccines as well. Mm-hmm. Although I believe there have been reports where people have said they will get an incentive and then they end up not getting it. So again, it's all about not having good information flowing from, inside to the outside, right?
Mm-hmm. What's the numbers today? Lauren, can you talk about what's the numbers inside today, according to your latest data?
Oh, the number of, so which numbers? The number of people
number of cases of infections and the number of fatalities of those within those cases.
Yeah, you bet. Catherine, you might have those maybe at your fingertips.
Do you? Okay.
Yes, I can answer that. I just looked. So it's over 400,000 people in prison have been infected to date. And of course, that's an undercount. And so that's about, 30%, right, of the prison population. And it's a little over 2,500 people have died related to COVID-19. And we also believe that that's an undercount as well.
Okay. And is that data just from the 27 prisons? I mean, the 27 states that's contributing, or is that in general?
No, that's from 53 prison systems. So the 50 states, the Federal Bureau of Prisons, ICE, and Puerto Rico.
Okay. All right. Okay. So what can the public do to kind of like help I guess create the conditions where more states could get involved or should get involved, or where you could get more data, and two, maybe where there could be a better public campaign to encourage to get prisoners to get these vaccines. Lauren, you want to tackle that first?
Sure. So Catherine and I have done a lot of thinking on the inability to understand the health of people who are incarcerated and the impact that incarceration or any engagement in the criminal legal system has on the health of people who are incarcerated, their families and communities. And so I think, one thing that we've been thinking about is trying to educate the public on the scope of the criminal legal system in this country. 11 million people cycle through jail in any given year. Millions and millions of people are incarcerated in jails and prisons, and many more millions people are on community supervision. And so, if you think about the scope of the touch that the system has, it far outpaces the touch of any health epidemic that we have in this country. And so we've been trying to make that clear, and then relate that to the fact that, anything else on that same scale, full cities of people, that have millions of people. And then we know everything about that city. We know how many people are there. We know what their health conditions might be. We understand that because we need to know what resource allocation should look like for those people. And we don't know anything about the incarcerated population. And so, we've been trying to think about these comparisons of scope and number of people to try to just really communicate that this touches so many people, yet is really hidden in our society. And so that's one thing we've been doing a lot of thinking around.
Okay. Yeah, and I think one of the other messages to keep in mind is that it's great that we have vaccine allocations to people who are incarcerated, but we still need to focus on depopulation and getting people out of prison. And I think that should still be a priority in terms of policy and advocacy, is to reduce, get people out, right? Vaccine or no vaccine. We need to release people from prisons.
Yeah, and related to that, that makes me think there's, one thing that has come up very recently is, prisons and jails have in some ways used compassionate release as a mechanism to release a small number of people during the pandemic. And we've heard very recently that if you become vaccinated, that your name is removed from this compassionate release list. And so it creates this tension between reduction in population and vaccination. And it might actually make people less likely to get the vaccine because they are no longer on that list of folks to be considered for release. And that is unethical to us. These things.
And some systems.
These things.
Some systems have been revoking compassionate release as well.
Yeah, and so they really just need to be considered in concert and not in tension with each other.
Is there like, say, our audience now watching, is there anything they can do right now, even to the point of maybe getting in touch with the program you have? Is there anything they can do to kind of address some of this stuff? That's inhumane. If you get vaccinated to save your life, we'll keep you in jail. That's crazy. Right. Is there something our viewers can do?
Yeah, I think, okay, so one thing is, if folks have stories similar to these, getting in touch with us, I think would be great. We need more first person or family narratives around what is happening in prisons and jails across the country. And we also are developing a policy arm. And so really trying to understand what's happening in states will help us with that. The other thing is, I think getting in touch with your local Department of Corrections or jail or legislators in your state or in your local community to try to understand what is happening where you live, and then using that information to really advocate for better practices.
Yeah, definitely. I think getting in touch with your local legislators to demand transparency. And then I just want to reiterate what Lauren says. We can tell you the numbers. We can tell you 2,500 people have died due to COVID-19 in prisons. But, there's people behind those numbers, right? There's stories, there's families. And so I think being able to collect those stories and have people's voices heard sort of beyond the numbers is really important for creating compassion and creating empathy. And, the stories are what move legislators, right? And so I think that's something that people can do.
Okay. Any final thoughts?
I think I said this last time. more than ever, it is clear to the public that there is a strong connection between what happens in prisons and jails and surrounding communities. And we need to take better care of our populations, think about the harms of prisons and jails, both at the time of incarceration and long after. And we really need our public health partners to understand that as well, and to think about policy reform, public health solutions, so that we really are reducing populations and exposing less people to our criminal legal system.
Yeah, definitely. I'm hoping, I agree with Lauren, I'm hoping that we can carry the momentum of this moment where there has been so much public attention and media attention on the harms and the crisis that's going on within prisons and jails. And I'm hoping we can carry that momentum to get some serious, policy and reform happening.
Okay, thank you, Lauren, Catherine, for joining me. And unfortunately, we'll probably have to revisit this topic again because we're still in the middle of this whole thing. So Thanks for joining me.
Thanks for having me.
Thank you so much.
And thank you for joining this episode of Rattling the Bars.